Tempodrome! How are you? How are you doing? Yeah, I'm fine, thank you for asking. Oh, I'm good. Right. Hang on. Never mind. Thank you. Yeah, I'll do it without the pedal then. Oh, good, it works. Fine. Yeah. So I've had a fantastic time at SMAC, and we've had some brilliant speakers, and I've learned some very challenging ideas. And if you're like, oh, thank you. If like me, ooh, I've pressed a button. No. Yeah. If like me, your brain is a bit full, as you can probably see, don't worry. This session is going to be a little bit different. Sit back, relax, and enjoy. This is your emergency musical interlude. So I'm going to start by telling you a bit about what I do. Everybody wonders what anaesthetists do while the patient is asleep. Everybody wonders what we do for 3 hours while that machine goes beep. Everybody reckons we drink coffee and we gossip and we're generally subversive. Everybody reckons we do crosswords and Sudoku and we flirt with all the nurses. But do you really think that's all we do? Well, let me tell you now, it isn't true. 'Cause we sometimes check the screen, and every now and then we write stuff, and if we have to intervene, we inject a bit of white stuff, and we offer to alter the lights, or the height of the bed, or fiddle with the radio, change the CD. We'll even check the patient occasionally. And if they move, we turn the vapor up high so that we can go back to playing on our iPhones. 'Cause when the patient's asleep, we just sit and listen to the beep. We just sit and listen to the... Once upon a time, I took pride in my job, but now I think it's time to depart. 'Cause I just sit here every day and listen to blips of the heart. Thank you. So yeah, this is going to be one of those sorts of presentations. So when we talk to our patients about their alcohol intake, we have follow-up questions and we find out a bit more about it. But when we ask patients about smoking, we don't normally follow it up. I smoke over 100 cigarettes a week, but I never smoke on Mondays. No, I don't smoke on Tuesdays, Wednesdays, Thursdays or Fridays. In fact, I only smoke on one day, Saturday. That's why I'm wheezy. I'm wheezy on Sunday morning. Now, I enjoy anesthesia, but there isn't any money in it. So I'd need to think about doing something about drug development. Now, you might be familiar with something I came up with a while ago, a wonder drug called paracetamol-oxyfruzy-bendroneomycin. Well, I'm not doing that song. I had another idea. And that's how it goes. A hush falls over the meeting room, not a whisper to be heard. The board of directors contemplate one single word. Here's my proposal that is revolutionary to the pharmaceutical industry. We know most patients just get well, irrespective of any drug we sell. It's just their mental attitude. So why not use placebo? Placebo. People think that they need a pill. Placebo. Placebo. When they're actually not ill. A cough and sneeze needs no remedies, so we'll sell you these. A cold shouldn't bother you anyway. It's funny how statistics can prove anything at all. Be realistic, it's psychological. It seems to be down to belief whether what you're prescribed can give relief. So here's the drug we ought to make a fake. Placebo, placebo, just as long as you think it'll work. Placebo, placebo, then it isn't gonna hurt. No matter what it is, you can give them sweeties, except for diabetes. Yeah, got it. Oh, shit. I wasn't supposed to stop there. Right. Seek null hypothesis rejection, and we strive to achieve significance, p-value less than 0.05. But I take placebos every day, and I don't care. I'm hardly ever ill. Look at my lovely hair. Placebo, placebo, check it out and you will find. Placebo, placebo, it's mostly in the mind. We'll just say, we'll make your symptoms go away. You just have to pay. A cold shouldn't bother you anyway. Ironically, I think I'm getting a cold. Now a bit of practical advice. You need a little patience when you're trying to examine a child. They're a source of such frustration when you want them to stay still for a while. They fiddle, they gurgle, they giggle, they struggle, they wriggle. No matter how many toys you give them, they cry. God knows why. You must employ cunning tactics when you do pediatrics and try when you have a little patience. So there's quite a lot of overlap between anesthetics and critical care and emergency medicine, but that doesn't mean we always do things the same way. ED isn't the best place to tube a patient. I would rather be in theatre. I always insist that I have an assistant to help me to be near to all my airway devices. 'Cause what I find nice is when I use my fancy toys. I need a quiet location for oxygenation, away from all the noise. I'm going to grab my laryngoscope, a couple of Mac blades, bougie and a Gerdell, maybe a Miller as well. Wearing my apron, airways patent. Get the McCoy out too, CMAC and AirTrack, put that suction on full. Now come on now, give me McGill's. Now come on now, give me McGill's. 'Cause I'm obsessed with a grade 1 view. The patient is Malampati too. Help me out with some cricoid too. I'm obsessed with a grade 1 view. Last time I could not get through. I confess it was hard to do, struggling inside the mouth without a clue. I'm obsessed with a grade 1 view. While we're talking about airway equipment, the iGel, I-G-E-L, is pronounced in German Igel, and it means hedgehog. Right, human factors. The patient's here and we're good to go. Thiosucks and laryngoscope. We get the tube in, the chest's moving, cricoid off, and you do a little dance. But now the chest is tight and the sats are low. Where the hell did my ODP go? The patient's burning up now, it's MH, and then you wet your pants. 'Cause right now you understand that you need some dantrolene. Where do we keep the dantrolene? Oh yeah. Turn the oxygen up, you turn the vapor right off, and watch the CO2 on the screen. So get me a milligram, no, make it a kilogram. Just get me the dantrolene. Oh, dear me. Well, if you can't do a song about malignant hyperpyrexia at smack, I don't know where. Right, now, I don't know if you've heard, but in Great Britain, we're having a few problems. The government, Brexit, the NHS. So the pressure's really on for the junior doctors. Say hi to the professor. I'm your new house officer, and I've heard a rumor that you're no good at removing tumors. You've got no ability. You're a liability, and you can't deny that all your patients seem to die. But what you don't see is it comes down to me to try to explain again and again to relatives why their loved ones have died, you see. Tell me, why does every op you do lead to complications? It makes it very hard for me to try to explain to their relations why the patient cannot see, cannot pee, has PE, DVT, HIV. Yeah, it's my duty. Promise me you won't be doing any more operations. No, no, no. So, we're in Berlin. Do we have many people here from Germany? If we do, can you give me a silent nod? Good, right? So, the rest of us here then are going to be visitors. And it would be a shame not to take advantage while we're here to learn a bit of the language. So guess what? I'm going to teach you a bit of German. Kind of want to do it on a guitar. That's going to be tricky. We've got time. I took a photo of my guitar earlier. Yeah, well, there you go. Ooh, that works. What? This is perfectly normal behavior. I'm calling this an international presentation on my CV. Shut up. Right, so the German word for thing is das Zeug. So I'm going to teach you some things. A tool is something you work with. So a work thing is known as Werkzeug. A lighter is something you start a fire with. So a fire thing is known as Feuerzeug. A toy is something you play with. Play is spielen. So a plaything is known as Spielzeug. An aeroplane is something that flies. Flight is der Flug. So a flight thing is known as Flugzeug. All you people, so many people, let's all learn German words. Let's be German word nerds right now. Okay, animals next. The German word for animal is das Tier. A sloth is a lazy animal. Lazy is faul. So a sloth is known as Faultier. An armadillo looks like he's wearing a belt. Belt is der Gürtel. So he is known as Gürteltier. A duck-billed platypus has a beak. Beak is der Schnabel. So a platypus is known as Schnabeltier. A skunk, we all know what he does. So a skunk is known as Stinktier. All you people, so many people, let's all learn German words. Let's be German word nerds right now. There we go. You're all very kind. Right, and finally, a bit of balance for the placebo song. Here are the names of some more drugs. In fact, here are the names of all the drugs. Don't worry, it doesn't take long. There's aspirin, adrenaline, and also aminophylline, amphetamine, adenosine, augmentin, and rifampicin, amoxicillin, penicillin, heparin, and warfarin, estrogen, progestogen, and canesten, and chloroquine. There's bendraflumethiazide, and also cyclophosphamide, and metoclopramide, acetazolamide, tropicamide, the pyramide, amiloride, and cyclizine, and frusemide. And if you're up the duff, you had best avoid thalidomide. There's lithium, fluoxetine, and also amitriptyline, paroxetine, digoxin, GTN, and azathioprine, meconazole and tenolol, also chloramphenicol, and if you want to overdose, there's always paracetamol. Halfway through. There's nitness, there's phenytoin, Zyrtec, and diazepam, and lithium, temazepam, midazolam, clonazepam, testosterone, aldosterone, and Valium, and insulin, lignocaine, and piriton, and Ventolin, and Ritalin. There's cefiroxim, cefotaxim, cefalexin, kefridin, metronidazole, and ketoconazole, trimethoprim, erythromycin, gentamicin, macrolides, nifedipine, and Actifed, and Sudafed, and Calpol with no sugar in. There's phenelzine and hyoscine, ranitidine, cimetidine, potassium and calcium, and every kind of vitamin, and propofol and thiodex on dansatron and ephedrine, and suxan, rocuronium, sigamadex, and ketamine. You must remember all these drugs, the names of which you've learned from me, or stuff it all and get a job in orthopedic surgery. Thank you.